Right. Welcome to the Healthy Hustling Podcast. I'm your host, Dr. Eric Broadworth, and I am here today with Tony Kovicak. Tony is the owner and founder of Lux Therapy lights. This is a red light company. If you've been following anything that we've been doing here at Fuel, we have been utilizing red light with our patients. And I met Tony probably 3 months ago now ish. And it's been really cool to see how his red light unit has been able to benefit me, my patients. And so we wanted to come on and just talk about what is red light therapy, talk a little bit about Lux. And if you've heard of red light therapy, this is going to be very interesting for you. And if you haven't heard of it, you have now. You're going to start seeing this stuff everywhere. I'm definitely going to tell you that. It has been a game changer with myself, my own recovery, and my athletes. So thanks for coming on, Tony.
Yeah, thanks, Eric. Thanks for having me.
Yeah, absolutely. So let's did I miss anything there?
No,
Is there
you
anything
hit it
wanted
on
to
the
hit
head.
on?
I mean, it's an amazing modality that is new to the market, and it's one of the obstacles that we find is really people's belief that something like light can actually heal you in the way that it says that it can. And since 2015, the amount of research that's been happening around the world with photomedicine and photobiomodulation, which is the scientific term for it, is kind of unprecedented. There's 3,500 clinical trials that are going on globally right now, all across the world. And it's very amazing to actually see and read those things.
Yeah.
And being like you in the health and wellness industry, to have this with something that you can use with, whether it's a wrap or a device like ours that you can use in your home. You can use wraps in your home as well, but there's various different ways and technology that's out there that is incredible for us being in this space to actually be able to apply. So I'm very excited about that. And that's really what Lux is about. Like you use a couple different devices, which is great. I say,
we've used your device, which I think is definitely very beneficial. And then, we've got a couple other ones that we do use. And it's interesting how they can differ.
They do. They all have a different variation. And I say rising tide, raises all boats. And really, like, when we started getting into this space, I kind of realized, like, because once you start understanding the mechanisms of what's happening, it helps so many different things.
So how did you, before we even really talk about red light, how did you get into the space? What's your story?
Yeah. So background was I kind of grew up in athletics, and I was from a child, I wrestled. And during that time of growing up, I really was involved with, I listened to you and Rachel on your last podcast that were talking about bodybuilding.
Cool. Yeah.
And it was right during the time, like when I was going through that, it was the science behind eating and performance was really coming on board. But the bodybuilders were really the people that were actually bringing a lot of the great science to the table. So we were reading, my brothers, I have a couple of older brothers that basically had gone through it in a terrible way where they were cutting weight in an awful setting. By the time I started doing it, the science started coming out. So long story short, I became kind of infatuated with fitness and understanding how food and fuel can help with your performance. So that translated into a lifelong of me being kind of a biohacker, and from that, as I transitioned through my career, I worked, around the country. At a stage when I actually was living out in California, I was developing electronics for Google. I was going over to Asia quite often, and we were like, I started coming on to the red light therapy. So I'm like, what is this stuff? So I started buying these devices to understand it. And it really just became part of my life. And at that time, I realized there's such a gap with what is out there, and being able to bring this to the masses is really what Lux Therapy is about.
Cool. Yeah. I have just started learning about red light therapy really a little bit right before we met. It was funny timing because my business coach had talked to me about, hey, have you heard about this red light therapy? It might be something that you want to add to your business. And then you'd kind of reach out and I'm like, oh, this is like funny timing. And so since we started toying with it and, going based on what you said earlier about how much can light really affect you, right? And when I first heard about this, I'm like, it seems very just like not sciencey, seems very gimmicky, seems like just another thing, another fad, another gadget to have.
Yep.
But I was shocked when I saw there are hundreds of studies to support this thing. And my wife will joke, Jess, she'll say, hey, your magic red light thing, because it doesn't help with like just one thing. It's not like we use it for just one thing. It can help, and we're going to get into that, but it helps with sleep. It helps with like mood. It helps with if you're dealing with seasonal affective disorder, which we can talk about. It helps with performance, with tissue healing. It can help with weight loss and body contouring. It can help with all of these different things based on kind of what you're targeting and the system that you're using.
Right.
But it's been really wild to see that. And I've used it on my own shoulder. Rachel from the last podcast, she'll use it on her knee, her shoulder. It was actually, she had a really nagging shoulder injury, and we were using your light, and that helped get her. We tried a bunch of things, and it just kept nagging, kept coming back. And then that red light really seemed to like put her over the edge and like really take down that inflammation and pain. And she's been able to, do her CrossFit workouts and compete in competitions like pain-free and winning them. So
shout out.
Pretty wild.
I love it.
So let's talk about like, what is red light therapy?
Sure. So red light therapy is basically the electromagnetic spectrum interacting with our body at the most basic level. So when you think about light and what we know as light, you think back to Roy G. Biv as we learned in school, right? That's the visible spectrum. But you also have a variety of energy that is bombarding us all the time. But when you think about those specific wavelengths that actually interact and have a biological effect, there's really only 4 or 5 that actually do anything. So you think about UV light. UV light is great for synthesizing vitamin D, but it also gives you sunburn, right?
Which is why we need to be outside in the sun, but not get too much of it.
That's right. That's the challenge, right? And then you have, blue light that we hear about from our screens and our phones. Those kind of things actually affect our circadian rhythm in a very specific way. But then you have near infrared, and you also have a couple others that basically interact with the body. But really what they found with all of those studies that we were talking about, red and near infrared, those two wavelengths have the majority of the biological effects on the system. So those wavelengths, with kind of the advancing of technology, has really allowed them to harness and create specific power densities within the device that can be very specific in regards to the band. So like you were saying, like we go outside, it feels great. Like I got a sunburn on Monday in Michigan. I was sitting outside and it's just like, oh, this is great. It was one of the last good days within Michigan, right? But I got sunburned, and it's like, okay, because I wanted to be out there, but you can't, there's not enough time, especially being in direct sunlight, to get enough red and near infrared. That's the challenge.
And so near infrared, what's the difference between red and near infrared?
They just are very close on the spectrum. The red actually penetrates less deep than the near infrared and infrared.
When we're talking like penetrating deep, we're talking skin, correct?
Correct. Skin, like the red will penetrate between 2 and 4 millimeters. Near infrared is kind of debated, but they say 4 to 10 millimeters is kind of on average. It's kind of a tough thing for them to kind of study and understand what's going on. They have to do it on cadavers and whatnot. So
there's been a lot of animal studies too on like mice and that kind of thing.
Correct. So, in the in vitro studies, like you're mentioning, they're great, ways to start those conversations. But
obviously they're not the best studies. Human studies are going to be best. But like you said, there's more and more research and studies coming out in support of it. But and my understanding too, with the near infrared and the red, like you talked about on that visible spectrum, that Roy G. Biv, you got the red, right? And then near infrared is nearly invisible to the naked eye. It's not quite invisible, but nearly invisible. And you notice that like with your unit, like when you got the near infrared on, it doesn't look like much is happening. I a lot of times I'll use the near infrared just by itself. When I'm working on calls, I'll have it on. I have a sore ankle, like I twisted an ankle a few years ago, and it's always nagging. So I'll sometimes have it on, and it doesn't blow the whole room up like the red.
But the red is really good for the topical 2 millimeters, like skin, like coming on the podcast. It's like, all right, I'm going to make sure I do red for a couple of days, get rid of any wrinkles, make sure there's no blemishes. And it helps with that. I mean, you notice it kind of immediately. So that's kind of the real difference is how deep they penetrate into the body. So when you think about what you're trying to use it for, like your shoulder, for example, you probably wanted to use more infrared in order to go deeper, because that's where you have, bone and ligament remodeling that's happening with collagen synthesis, and all of that is happening at, a deeper level than just the upper surface.
Yeah. And that's what I've been targeting more, is definitely that near infrared, when, especially like if I'm using your unit, we're targeting that. So that's pretty good explanation. And then it also, obviously you can get into the science, like the wavelength. Do you know like the nanometer wavelength between red and near infrared?
Yeah. So like your red goes between 600 and 700.
Yep.
And then 700 to 800 is kind of this range that they haven't really found that it really provides too much biological effect. And then it's from 800 to 900.
Yeah.
So, we're hearing about, infrared saunas.
Right.
The infrared saunas are usually 900 to 1,000, and they're usually panels that just provide radiation that you can't see.
Yeah.
But what they're doing is it's heating the cell. Yeah. It's heating the cell in a different way. So that's kind of the thing. It's a detoxification of the cells, and that's kind of the mechanism that is provided from that bioactive light.
Yeah. So can you just go and put like a red light bulb in and get the same effect?
You can, but it doesn't provide the power. So really what you're trying to do is have the amount of power that will penetrate and provide a very specific dose. So it gets a little complicated, but you have a radiance, which is really the output. So when you measure the light, like the sun, for example, you get a very specific full spectrum density, but that's across all bands. But when you buy the lights that we use, you're getting a power density of a very specific wavelength. Okay. So, and all of these trials are done a specific quantity of joules per centimeter square. So not to get too technical, but you basically have to get efficacy out of these things, you have to sit in front of it or use the light for a specific amount of time in order to get that biological effect. And the interesting part of it too is that there's a biphasic response. So some people think, wow, there's really no effects, no side effects, but you go past a point where you are gaining any real benefit. Okay. So you have to be kind of careful about, you can't just use these things all day long, because you'll go past a point of recovery. So that's the importance of understanding the quality and also the amount of energy that your device is providing at a very specific distance. So when you use our device is very powerful, and it's designed to be used like in a workout setting. Okay. So you use it when you're, doing yoga, for example. We use it a lot that way. You have it 24 inches away. It allows you to use it for 30 to 45 minutes without going outside of that range that I was just describing. Okay. But if you're using it 3 to 6 inches, you don't have to use it as long. And same thing with the wearables. You put that on, and those have a different kind of dosage metric. So you have to be careful in understanding exactly what you're doing, because you go within that biphasic range. You want to be right at the peak. So once you know that and you understand, you have to correlate it to the study, and it's a whole complicated scenario.
So is it safe if you go past that range? Like, are you doing any harm?
No harm, but you lose all the benefits.
Yeah. So you're just not doing benefiting anymore. You're just kind of wasting.
You can use
time.
it, like, for example, when I bought these devices for my family, and one of my brothers, he's way more hardcore on this kind of stuff, and he used it, and the next day he's like, man, my skin is really tight. I'm like, how long did you use it for? He's like, 45 minutes. I'm like, okay. Overdone it.
Yeah. So who is there anyone you wouldn't recommend it for? Like you cancer?
Use it for cancer is a fringe. Pregnancy, anybody that is pregnant, lactating, you shouldn't use it for that. Epilepsy, it can cause some type of reaction as well. Seizures. So you have to be careful with that. Seizures. Those are the three main ones that you really want to be careful with.
Yeah, and that's what I'd found too, like in my research. And if we're not recommending it, we're always screening out those things because we want to make sure we're safe.
Sure. Yeah, for sure. I mean,
you don't. That's very safe.
It's very safe.
Yeah.
It's kind of, you know, I have friends that use it in more of a therapeutic kind of wind down.
Yeah.
And we built ours around, like, ours is very flexible, right? It's got a kickstand built into it.
Yep.
You can use it in a lot of different settings, and we try to use it so that you can incorporate it into whatever your routine is.
Yeah. So getting into kind of some of the nerdy stuff, you know, what I tell my patients, and you can tell me if I'm wrong or if you have a different explanation, maybe that's better. But like, so what we're doing is affecting, like you said, at the cellular level.
Yep.
And one of the hypotheses is that we're affecting really the mitochondria of the cell. So the mitochondria, for those who don't know, it's this part of the cell that is known as the powerhouse of the cell. It produces ATP, which is energy, right? Adenosine triphosphate, which we need in order to live and to function and everything like that. And so we're helping our cells create more ATP, create more energy. Would you describe it in another way?
That's the essential parts of what is happening. The way I like to think about it, and the way I've kind of come to understand what's happening, and you think about all of our systems. Mm-hmm. Our systems are there. There's many forms and microsystems that are happening in order for us to stay healthy. But the beauty of what red and near infrared does is it stimulates that mitochondria that you were just talking about. Every cell in our body, besides a few specific blood cells, have a mitochondria. So whatever that cell is meant to do, it does better. So when you think about what you're doing is you're laying at the lowest biological level, molecular change, you're optimizing the molecules, which then have a cellular effect. So you're affecting all of these pathways. You're affecting, you know, these cells that basically help with things like mTOR, you know, inflammation, you know, pain, like neuropathy, like we were talking about earlier.
Yeah.
You know, you have these systems that when they're not optimized, they have a very dysfunction, and mitochondria dysfunction is kind of related to kind of like it's a form of aging that people are really coming to terms with, that it really is what is causing like the degradation of our elderly population.
And so that mTOR too, that's, it's interesting you bring that up, because I didn't necessarily even know or think about that, but that's what we're using too and affecting with blood flow restriction training when I'm doing that with patients. So for athletes or anyone looking to improve their fitness level, it's been shown to help with elderly people, but improving that mTOR and production and everything will help with recovery and strength gains and everything like that.
It's, you know, there's 25 to 30 microsystems and pathways that are being triggered throughout this process. So when we go down a rabbit hole on mTOR, you and I need 4 other podcasts because it's so complicated.
Yeah, right? You can go down a whole lot of rabbit holes.
And the beauty of it is, going back to what we said before, is really no real downside to doing it. So that's why a lot of people use it and they have very anecdotal results, because their system is different, right? My system, I'm drinking kombucha, may be different than your system, right? So I may not need to be optimized in a way that you do. But we all see an interesting effect that really helps us, you know, be better and feel better. You know, that's kind of the goal. A lot of this came about just thinking about, I've often thought that a lot of people don't understand what it means to feel good.
I would 100% agree with that.
You know what I mean? Like when you are optimized and that becomes a way of life for a while, I've really thought that a lot of people don't understand what it means to be healthy. And I think we've seen in the last 2 years.
Oh yeah, 100%.
Especially with COVID,
we've gotten sicker and fatter, and
I mean over decades, right? But it's one of those things that when you can add something like red light therapy, where you're sitting watching TV to feel better and sleep better, and you have that anecdotal scenario that helps you, that's great. That's kind of one of the keys.
Yeah, definitely very interesting. So there's all sorts of different like light therapies, and we kind of touched on, you know, just putting a red light bulb into a socket, is that going to help you? Yeah, it might a little bit, but not quite as much as some of these other units, just based on the power production.
Right.
What's the difference between that and like laser, when you've got like your grade 4 laser and all of that?
They're pretty much the same. It really comes down to the power of the device. So that's
the grade 4 more powerful, would you say?
It is, because it's a concentrated device And the ones that they utilize for, some of the podiatrists that we work with, they have the devices that are very spot treated.
Yep. And I said grade 4, class 4. And that's where you're taking this wand and rubbing it over an area.
But essentially it's the same thing.
Okay.
And what it does is it provides so much power in 3 to 5 seconds, whereas our device would provide the same amount of power in 5 minutes.
Gotcha. And so this is also called, like, another name for it, if you guys want to look it up, is photobiomodulation, correct?
Photobiomodulation and low-level laser therapy and cold laser.
It's all the same
All
thing.
of those are the same.
Okay.
And that's really kind of the advent of why you've seen since 2015 the quantity of research that has come out, is because the technology, when you would see these devices back in the 80s and 90s when it was in dental practices, the devices were the size of tables.
Really?
Enormous.
Yeah.
In order to generate that kind of power in a specific band, now the way you design these devices, you have small little drivers. The technology has evolved, especially with LED technology, that you can get a very specific wavelength within 5 nanometers.
Yeah.
Before it was just a broad spectrum.
Right. That's interesting. I mean, you see that definitely with technology as far as needing less bulky items, right? I mean, between computers and laptops and phones TVs and to phones. Everything. I mean, your phone is as powerful as like a computer. Yeah, a few years ago, it's pretty wild. Right? Yeah. So going back to, we talked about like vitamin D and seasonal affective disorder.
Yep.
So this can help, correct? Like if you, so I guess, does it affect vitamin D levels? And then talk to us a little bit about like that seasonal affective disorder, because as you said, this is one of the last like nice days, nice weeks in Michigan. It's going to be cold. It's already dark by 7 p.m. Right. I've got to walk my dogs in the dark. It's not fun. Yeah. So talk about that a little bit.
Well, with seasonal affective disorder is a challenge because it is more about the white and the blue light that actually affects your serotonin level. That's through the optical nerve. So it doesn't affect it in the same way that like a sad light they have. It's like a light box. It's really, really bright white light that really like triggers, it stimulates that serotonin.
Okay.
Vitamin D is synthesized through UV light. So same thing. Unfortunately, it doesn't, but it's really about optimizing the system. It allows you to actually process more of those vitamins through your system.
Okay. Interesting.
So having a more optimized system would allow you to actually get more out of whatever nutrients you have in your system. That's kind of the thing that really helps with a lot of these things, is whatever's in your system gets optimized.
Yeah. So it's going to optimize your system. So that way, like, you need less time in the sun because your system's going to be more efficient to produce that vitamin D. Is that correct?
Yeah. Yeah. And one of the really interesting parts of what red and near-infrared light therapy does is it provides cytoprotection too. Okay. So what they found is that when, they did it in vitro, but they exposed cells to like, formaldehyde and a few other chemicals. And when they put red and near-infrared light on it, they actually held up better. They weren't affected by poisons and toxins. So this helps with a lot of different things in relation to being exposed to UV light. Okay. So a lot of times with my friends and my family, say, if you're going to go to the beach, do 15 minutes of red light before you go. So, oh, really? Why? Like, well, it'll help energize your cells so that they can bombard those UV rays better. And then if you get sunburn, do it at night. And it'll
because it will help with burns.
Oh, crazy.
So
that and like poison ivy and eczema and any of that, psoriasis.
Yeah. So interesting. With some of the skin disorders, helps clear that up, helps clear up blemishes. I had a patient yesterday who came in with so he's got a sprained ankle. He's got some pretty good bruising, and I'll post a photo on here so you guys can see that. If you're listening on YouTube, you'll be able to check that out. But he posted before, he took a photo before and then looked at it after. I didn't even think to look, and he goes, holy cow. He's like, the bruising's like significantly less. And so I'm like, can you take a picture of that and send that to me and send me both of those? So it was literally before and after. The lighting's a little different in the photos, but less bruising within just 30 minutes of using red light. So
I've had friends and family that have used it for poison ivy. Just a crazy rash, and just within 2 days, completely stops the inflammatory response and puts the body into a healing state. You still have to go through the normal cycle,
Yeah.
but it helps with those types of scenarios, things like cold sores and things like that. Like any type of skin ailment helps push it through the cycle.
So if you get cold sores, red light can help with that.
Oh yeah.
Yeah.
I got
my family deals not with the cold sore aspect, but going back poison ivy aspect.
Oh, yeah.
So I will definitely let them know. Sorry, what were you going to say? I didn't mean to cut you off.
I mean, the thing with cold sores, no one ever wants to talk about them. It's like one of the worst things in the world. It's like, you get a cold sore, but I got one a year ago and I'm like, I'm just going to blast this thing with red light. And I put a very stringent regimen in place. And within 3 days,
what was that regimen?
I did. So initially, as soon as I felt the tingle, if you ever get a cold sore, you usually feel a tingle. I did 20 minutes at 6 inches. And then every 6 hours.
Near red or?
I did both.
You did both red and near
both
infrared?
Because I wanted.
So it was a total of 40 minutes then?
No, well, they were at the same time.
Okay.
So I ran both. Like on the light, you'll see there's a near infrared and a red. So I did both settings full blast.
Okay.
So I did both for 20 minutes. And then every 6 to 8 hours, I would do 4 minutes.
Okay.
And then the next day at night, the next morning, I would do like 15 minutes. And you could feel it. Like your skin is tight, like it's going through a healing process. And within 3 to 5 days, it was like, I've gotten it my whole life. And it's like within 5 days, it's just like, oh my gosh.
Yeah. Cause usually that stuff will last for quite a while.
It can last 2 weeks.
Yeah.
And you're dealing with that. It's no fun.
No.
So I wish I had those things as a kid, you're growing up, you're conscious of that stuff. And it's,
yeah, that's awesome. From an athlete standpoint, so like, we're using this in our setting with athletes, helping with injuries, getting over that, and recovery from a recovery standpoint, even if they're not injured, right? We use it from a body contouring and weight loss, which we really haven't talked about, and that's fine, but it can help with actually losing weight. I've got some different material out there for that, but from a recovery standpoint for athletes, what do you typically recommend?
Recovery, what you want to do, like it helps with performance. So they recommend, a lot of the studies have said to do 15 to a 20-minute session, 3 to 4 hours before the activity.
Okay.
And then for recovery, like as a daily type of regimen, you'll do, it helps move the lactic acid up. So you want to do it after as well.
Okay.
So once you go in and you're training hard, you do it on a leg day. Do your legs as much as you can. Same thing. You want to do 15 to 20 minutes. Near infrared's most important, but I do both near infrared and red at the same time.
Okay. Interesting. I think that'll be really good for
sure
my athletes to know. And
I like to set them up in the gym and do in between sets.
Okay.
Just as you have it set up, so they're doing a set, and whether you have a sore wrist, you have something that's hindering you, just get over in front of it, even for a minute or two.
Okay. Interesting. Yeah. I didn't think about doing it like in between sets, but that can make sense. It's not going to hurt.
Good advertising for the gym too.
Yeah.
Lights up the whole gym.
Yeah, absolutely. Yeah. Do you recommend, is there anything harmful? Like your unit gets really bright. Is there anything harmful with like eyes if you're looking right into it?
No, actually, we don't recommend looking into it. It doesn't hurt your eyes. It actually helps with retinal degeneration.
Yeah.
But it's just more uncomfortable than anything.
Yeah. I've actually got, I've got my grandparents using one of your units for like neuropathy and also retinal degeneration. And so
I have them set up on my desk where I'll be working and it'll be shining side. So I'm getting indirect light and then I'll flip it over on the other side. So I'm getting both sides.
Yeah. So
I'm kind of basked in it the whole time.
Yeah.
So, I'm getting a full dose like throughout the day.
Cool. Awesome.
Yeah.
Is there anything else that you would want to hit on? I mean, obviously you could talk about this all day.
We're just kind of scratching the surface. I think people should research it and understand what's going on. I mean, it's kind of one of these things that you need to understand it, but there's really no downside to it, like we had mentioned. So if you want to jump into it, I would say go for it. But there's so much information out there. Email one of us. You can direct message me at luxtherapy.com.
Where can people find you?
Luxtherapy.com. Go to the contact form and reach out to us directly.
Okay.
And we'll get back to you and let you know if there's anything that you have any questions that are outside of what we've covered, or you have a specific ailment, we love sharing the research. Our team is very in the trenches. So when, we get a lot of questions from people saying, hey, does it help with this? We're not doctors. We can't provide medical, but what I can provide is 10 studies that you should take to your doctor. And that's kind of how we kind of position it. It's like, hey, we want you to have as much information as you need in order to make an educated decision.
Cool.
So we love doing that, and we welcome it.
Yeah. And then what about any social channels? Are you on social at all?
Yep. I'm on Instagram at Lux Therapy Red Lights, and same thing at Facebook.
Cool.
Yep.
So yeah, if you have any questions, don't hesitate to contact Tony, luxtherapy.com, or on his social channels. We'll put those in the description and comments below and all that fun stuff. And then obviously you can reach me and find me if you're watching this on YouTube, leave a comment below, or if you're, following me on Instagram at drericbroadworth.dpt.ocs. All of that, those links will be in the description for you. Cool. Awesome. Thanks so much for coming on, Tony. This was, I learned a lot. I'm sure the listeners here learned a lot.
Sure.
And we'll have to do this again for sure.
Yeah, I would love to do a part 2. So again, reach out, let us know if you have any questions. Great. Thanks for having us.
Cool. Thanks. Have a good one.
All right. Cool.